Here we go. All right. So welcome everybody to the 32nd episode of the SFU Sports Analytics Virtual Seminar Series. Today we have our distinguished guest, Professor Franco Impellizzeri from the University of Technology in Sydney. And the title of his talk is Understanding Training Load as Exposure and Dose, Lessons We Can Learn from Epidemiology. So Professor Impellizzeri's biography is at the link shown below. It's very extensive and I've kind of summarized it as such. Hopefully it's okay. But he completed his PhD at the University of Science and Technology in Norway with a project on high intensity training in soccer players. He then began his distinguished career in 1997 as a researcher in the private sector, working as a coach, and then becoming head of research at the MAPI Sport Research Center in Italy. And for those of you who are in cycling, or who know about cycling, it's that MAPI. Hopefully I'm pronouncing that well, or pronouncing it correctly as well. From 2007 to 2018, he moved into a clinical setting where he served as senior research fellow at the Schulthess Clinic in Zurich, Switzerland, where he was head of the lower limb clinical outcome group. Here, he started specializing in methodological aspects of research by completing courses at various universities. And then in 2018, he moved back to sport full-time as professor in sport and exercise science and medicine at the University of Technology, Sydney, Faculty of Health. Altogether, he has published over 170 papers in the area of sports science and orthopedics, and he plans to conduct more research in the area of injury epidemiology, while continuing working on training, testing, and monitoring of athletes. And again, if you're interested in learning more, there's more that you can read on the link shown. So in terms of the talk today, he's basically going to go through some of the various terms used in sport and exercise science and medicine that are derived from epidemiology and also the field of pharmacology. So conceptual and nomological frameworks have described training load as a higher order construct encompassing two subdimensions, external and internal training load. In this talk, he will demonstrate how the concepts of training load and its subdimensions align with classifications used in occupational medicine and epidemiology, where exposure is also differentiated into external and internal dose. The meanings of these terms in the area of epidemiology are also explored, and these terms and underlying concepts are then contextualized to sport and exercise. So furthermore, he will explain how these concepts can assist in validating measures of training load. The measure of exposure should be selected to reflect mechanisms linking it to the response of interest. While the exposure or dose response can support the validity of a measure, the absence of this relationship does not necessarily invalidate a measure unless it rules out the possible alternative reasons explaining the failure to identify a dose-response relation. Without a reference conceptual framework assisting in defining the potential mechanisms, the corresponding measures of exposure, relevant responses, and anticipated relationships, it is not possible to validate any measure. Regardless of how novel or advanced a metric appears, if it cannot be connected to a plausible mechanism or relevant responses, it is likely of little use to support and optimize the training process. So in the field of sports analytics, there's lots and lots of metrics that get created, and some of them are better than others. So I think this is going to be a really informative talk for everybody involved. So thanks again for joining us, and I will turn it over to you to share your screen and to get started.
Thank you, Dave. I share the screen. Okay. Do you see the screen?
Yep, looks great.
Okay, perfect. So thank you very much, Dave, for the invitation. As we said before, this series of seminars is very good. So I'm really honored to be part of this initiative. As you mentioned, there's a lot of matrix. The problem is that matrix are mostly created by associating variables mathematically, which is okay, but basically at the end of the day, they reflect mathematical constants and not real, let's say, biological or physiological construct, which is a problem when you want to interpret data and any graph, any dashboard that are very commonly used in teams, in professional teams, sports, and so on. My topic is more conceptual. So I want to talk about the concept, how training load was, the idea of training load concept was developed. So I will provide a brief of history. This is my outline. An important point when examining any measure of training load is to understand, is to have in our mind the conceptual framework. So something we can refer conceptually and theoretically. This means that we should know and appreciate also the difference between concept and how we define and we create these constructs. Recently, we are preparing a paper in which we want also to show how the terminology and the classification is not something artificial, is actually a sort of normal evolution of the concept, and is very similar to some classifications that are used in epidemiology, which has a long history. This is important because also interpreting training load as an exposure, which is actually one of the reasons why in several studies training load is used. When you see studies associating training load to performance or training load to injuries and illnesses, basically we have an outcome, which is the performance or the health-related outcome, and an exposure, which normally is training load. So it can be very helpful to rely on other areas. And this is something I always suggest. Sports science is a multidisciplinary area, which means that we should collaborate with other disciplines, but this also means that there are a lot of other areas from which we can take something. I normally say, let's try not to reinvent the wheel. And I can say it was a very good experience to me, for me to work in a clinical setting. So I moved completely away, actually, from sport, because I realized, and that was probably the game changer in my career, I realized that when I moved in sports, from sports science to clinical setting, I was thinking to be, let's say, I was young. So when you're young, you tend to think you are better than you are. But I was thinking to be quite good in terms of research methods and these kind of things. And after the first year, I was almost depressed because I realized how crap I was. So basically, I realized that we were doing things that in other fields have been done 20 years before. We were repeating the same errors. So I was thinking, okay, why don't we copy the state-of-the-art methods instead of repeating or inventing the wheel? And this is honestly what I think we are doing several times. Now we have analytics. I have some friends actually that work in analytics in economics, and I see the same. We are doing things they already did, and some they already dismissed because it didn't work. So I think this is important. So I want to contextualize a bit why I'm talking about epidemiology, because that's an area where we can take a lot. And I finished my presentation describing the revised framework. So I will start with a brief history showing the first framework, and I will explain the last version. So these are the contents of my presentation. So I start with a very brief history of the training load. Actually, I presented with Marcora this classification, internal and external, at the European College of Sports Science in 2003, where I was invited by Tom Riley, who was an incredible and awesome researcher, and I would say one of the fathers of sports science internationally and in UK, talking about physiological assessment of aerobic training in soccer. So I want to underline the aerobic because that was the main goal of that presentation. And while to present our approach to testing athletes and the various physiological components of athletes, we wanted to provide a conceptual framework to explain what components of the training we try to assess. And I used a classification of internal and external load that was actually used by my former boss, Aldo Sassi, who was the coach of the Mapei cycling team. Some people wonder why he was not a co-author, and the reason it's easy. When I ask, do you want to write with us the paper? The answer was, yeah, you know, I don't give a shit about soccer. I prefer cycling. Sorry for the language, but this is what he said. So, but I want to acknowledge that the classification was proposed by him, and this was the classification that he used when he developed the program. Unfortunately, he passed away for a brain tumor, brain cancer, but he was one of the person that influenced a lot my approach. So this was the first framework that we present in that paper. As you can see here, there is the training processing, which we have two components, internal and the internal load. And we defined the external load as a quality and quantity organization of the exercises. And there were also an element which was the individual characteristics that, of course, influence the responses. So that was the first framework that we presented. Why the main reason of this framework was to define the measurable components. Remember that the title was physiological assessments. So we wanted to explain what we wanted to measure regarding the training process, what components we wanted to measure. But we wanted also to underline two important aspects. One is that the role of internal load in terms of the biological role. So when you train someone, the reason why you're going to improve some physiological characteristic is because there are internal responses. So there are biological responses. And this is related to the external load. So now after elaboration, I can say that basically the external load reflects the behavior. So someone is running, someone is jumping, someone is lifting weights. So this is what you see when you observe an athlete. And this we define what happens outside the body as external load. So that was the classification inside and outside. And this, of course, influenced the internal load. And we did that because at that time, and unfortunately, in my opinion, also now, there was too much attention on the exercise per se. So how the exercise looks when I watch someone running or playing, and this was related to the concept of specificity, you know. It's very similar. So I use this because it's very similar. But and that was not the approach that we were using at that time when training. So when we train, we were more thinking about the internal load. So what are the physiological characteristics that this specific exercise is creating? So we wanted to move the attention from what we see to what we don't see, but are the key causes actually of the training. After years, actually, in these 15 years, there was my break in clinical setting. And I want to also say that, honestly, when we proposed that framework, we didn't think it became so commonly used also in terms of terminology. That we just created that for the paper, and we basically communicate our philosophical approach to monitoring and to assessing training. So after years, we explain a bit more, because if you read that paper, we didn't expand a lot the concept. We just presented in the introduction as to say, okay, that's the framework that we are using for this article. So over time, it was elaborated also by others, and we also further elaborated theoretically and conceptually. So that's why we published this paper, and also because the concepts were not actually used in the way we wanted. For example, there were some studies saying that the heart rate variability was a measure of internal load. Actually, we use the heart rate variability also at that time. It was not easy like today, it was much more complicated, but actually we use it. But we didn't consider a measure of internal load because it's something happening after, unless you use the heart rate variability during the exercise. So for us, it was a sort of is an effect because it's something happening immediately after or 1 or 2 days after. So we wanted to clarify these main points. In that paper, we introduced we expanded another concept, which is this first part, in which we wanted to basically to explain to what you apply that framework. And we wanted to underline a bit more the planning phase, which is, in my opinion, the key also of the interpretation of any matrix. So basically, when you have a performance, or you can substitute performance with injury, illnesses, whatever outcome, but when you have a performance, what you should do is to understand what are the determinants of the performance, or what are the physiological or physical characteristics that cause the performance. And that's important because these are the targets of my training. So if I'm training a cyclist and I think that the aerobic power is important, that's something I want to train. So I will adopt exercises and strategies to improve that specific performance. And that performance should be a determinant or relate in some ways to the performance, but not related generically. It should be causally related to the performance. You don't want to improve something that has no relation to performance or relation to injury or illnesses or whatever. So that was what we had in that framework, and I think is very important. Again, this is important because when you want to interpret a number, you need to understand in what context, what does these numbers, what information this number is giving me. Okay, so that's why we added this part. The planning phase is the strategy that we are going to use to improve that target characteristic. And that's a fundamental aspect of, in our opinion, monitoring. I think it's very related to the concept of analytics, because you have to interpret whatever measure you're producing or whatever analysis you are producing. And why is important planning? Because this is how we approach also our the interpretation of this data with the teams with whom we collaborate. If you don't know the planning, it's very difficult to understand how to interpret. So basically, if I know that you are training someone because you want to reach a certain amount of activity or acceleration or whatever, that is one of the target metric or variable that I will try to have to monitor my training. So why conceptual frameworks matter? If you have a look to our recent publications, we focus a lot on conceptual frameworks, and this is something, I have to be honest, is something that I start to really appreciate when I move in clinical setting, because I was working Clinimetrics. Clinimetrics is the measure of patient perceptions. So it relies a lot on the psychometrics, and it's very complicated, that area, because basically you are measuring something that you can't touch, you cannot see. I mean, you can see the behaviors that are the consequence of some physiological attributes and attitudes, but you don't have an instrument actually to measure. And in order to measure these abstract concepts, you need a real strong conceptual framework. Otherwise, you don't know what you are measuring, you know. So the concept of when you have a conceptual framework, or when you want to develop a conceptual framework, basically you are theorizing. So it's a qualitative process. This is, in my opinion, it's very interesting. I mean, I'm a bit a nerd of philosophy of science, these kind of things, but that's, in my opinion, one of the essence of science. So inferring to the best explanation, try to combine all the knowledge I have to produce a theory. And the framework, the conceptual framework, is a network of concepts that are related to each other. So you have a lot of concepts, and you have to try to understand what's the relation between these concepts. Said in another way, and this is actually how I start to approach this way of thinking, is at one point, because I was, until I was in Switzerland, I was also a coach. I wonder why I was writing or developing a training program that way. So I was thinking, why I'm writing 3 by 10 repetition maximum? Why that? Why that? Because is there really a reason? Is because I was taught to do that and I'm just doing automatically? So I started to think a lot about what generated my programs. And I associated this to my experience I was accumulating in clinimetrics. And so I understood that there was inside of me a framework. So I started to draw my framework in my mind and so on. And of course, was a lot influenced by the framework I presented in 2003, because that was the way actually I was taught to assess and coach and so on. But the conceptual framework is very important because you need to understand the relation between the concept. And it's not just a list of concepts. You have to give to give a sense to this concept. You have to understand how one is related to the other, and not only related, if one is causing something else, because we always mask our causal goals with association, description, but at the end of the day, we are not interested in associations. We want to know if a variable influences another variable, because we want to manipulate with training or intervention a variable. So I know that you already addressed the causal inference, and that's something I'm doing. I started to do years ago, but that's fundamental in my opinion. I will touch this a bit later. And when you talk about when you focus more on variable and factors, normally we focus on model. I don't spend time about the difference between conceptual frameworks and model. I just say basically that a model is a representation of the reality, is a simplified representation of the reality that not necessarily is right, but is functional. That's an important concept. It's a simplification. Any model is a simplification, but it's a simplification that works. I give you an easy example. It's like a map, Google map. Is not exactly what you see when you drive. Is a simplification, but it works because you move from one point to another, and it serves the purpose. In research, the conceptual framework is something that you use to organize the first principle. So the basic knowledge, you organize your basic knowledge. It's fundamental to identify the measurable components, which are, I will explain later. When you have a construct, you have to operationally define this construct. And you have to anticipate the relation. And this is important, especially in research, because unless it is exploratory, normally you want to understand this causal association. So you have to anticipate what can influence another variable and so on. And this is fundamental for validation. I will explain it also better later, but if you don't have a reference conceptual framework, basically you are not validating, you're just fishing in the data. But this is also important in practice. So I don't want that people think frameworks is just a very theoretical for researchers and nerds or lab rats and so on. That's very important. And actually, I as I explained you, I start to focus on frameworks also to coach, because when you want to develop your framework, you need to organize your knowledge and also experience. So you at one point you have to give sense to your experience. Oh, sorry. You have to identify the measurable components of the training plan. So if I want to monitor the training, what variable do I use or do I select to measure the training process? I have to anticipate the training effect, because we don't train someone with strength training because there is an association. We train someone with strength training because we think strength training improve a characteristic, so cause an improvement in characteristic, and this improvement in characteristic cause an improvement in performance. And the framework, as I explained you with the first framework we presented, is a structure also for monitoring. So what aspect of the training I'm measuring and I want to monitor? As I told you, we have worked on several frameworks. This is a framework developed by Judd Kalkoven about what can cause an injury, and that's a bit the framework. I just show this framework now, but I will go more in details later. Terminology, there's 2 days ago, yeah, I think it's 2 days ago, one of our last paper came out, was published online, about the concept of about the terminology, and specifically about the training load, training load and the use of the term load. So I think there is some confusion in the use of terminology, but not because the terms are not right or wrong and so on, because we don't understand sometimes why we need to assign label and meanings to terms. And these terms and these meanings are context specific. It doesn't exist a term that has only one and generic definition can be applied to everything. So that's why it's important sometimes also in the papers. I become mad when I read the papers. I don't understand what people mean by some term. I would just prefer to have at least a sort of glossary where people say, I mean this with this term, because sometimes you have to understand while reading what they mean, which is something that honestly is not concerning, because it doesn't touch the validity of the study. It's just more difficult to follow. And sometimes I realize also when I speak with people that we are talking about different concepts. We use the same words, but we are talking about these different concepts. So what is a construct? You can find a lot of definitions. I picked some definitions that I like. This is from the APA dictionary. Is a complex idea from a synthesis of simpler ideas. And this is something I like because it's more related to the concept of science, so the means by which science order observations. This is important because now I'm talking to the sports scientists. We are scientists, so we have to understand what role we have in the scientific process. A concept is an idea that represents a class of object or event or their, oh, sorry. I don't know what happened here. Anyway, the difference between the concept can be interpreted in two ways, in terms of levels of abstraction. So normally the constructs are a higher level of abstraction, and or in terms of generalizability. So normally you use concept with something more tangible, let's say. So it's a different level of abstraction. As I said, there's some confusion in terms of definitions. This was a paper published on Journal of Science and Medicine Sport in 2021 by Stoughton and co-authors. I show you this because the paper that came out 2 days ago is, I wouldn't say the paper is not really a rebuttal, is more a different opinion. Let's interpret it as a different opinion. I don't spend time to the debate. I will focus on the contents of our paper. If you are interested in the debate, or if you're interested in a paper which is more a rebuttal, there is the preprint, which is much longer than the review that we could publish, and the reason for various editorial reasons. So if you are interested in the debate, you just you can have a look to the preprint, where we answer to more specific contents of the first paper. And there is also a letter to our review, our article in response to their article, and there is our reply. So there is this debate, and you can see there. So I focus on the main contents of our article, and basically what we wanted to explain, because this was an error that I have seen also in other papers. When you have a construct, you need to use a label. A label is because we have to communicate to other people what construct we are referring to. So I need to assign a name to this construct. But once I assign the name, I have to provide the so-called constitutive or descriptive definition. So it's a theoretical definition that gives meanings to the concept or construct under investigation. So this is the name of the construct. This is how I define this construct. But after that, once I define the construct, I also need in science, and especially I also need to measure this construct. How do we measure this concept or construct? And so I have to provide operational definition. The operational definition is a process. The process that from a concept give me back a number, a measure. So I have to quantify this concept. This allow me to have the variables that I will use. For example, in analytics, you have variables. This is what you look and what you analyze. But the variable is the product, should be the product of the operationalization of the construct. Okay, that's an important aspect. So associating this, and there's nothing I'm inventing here. I mean, this is there are a lot of textbooks that explain this, a lot of papers. This is a relatively normal, established knowledge, let's say. So, but using this to explain the terminology, the training load terminology, I can just say that the constant label that we assign, the label that we assign to the constant was training load. The training load needs to be defined, and we have provided definitions of this construct. For example, we said that the training load can be described as a higher order construct. So we use the term high order to explain the multidimensional nature, and the top of this classification system, let's say, there is training load, reflecting the amount of physical training that usually is actually done and experienced by the athletes. In our paper, in the last papers especially, there is a table with all the definitions. I may understand that and this is actually something that on which we are working, that there are different definitions, and this may be confusing. Absolutely, that's true. But it's not dismissing terms that helps to clarify the definition. It's probably better to try as a scientific community to have a sort of consensus about the terminology. Once you define the construct, you have to operationalize this construct. So in terms of training load, as being a multidimensional construct, you can have a lot of operational definition. You don't have one, and that's why you have a lot of variables. So even in physics, there are different ways to operationalize even physical quantities. So but this is important because this is what generate the variables that you use in analytics, for example. So the training load in the classification, the training load is the label of this overarching construct. And there are two subdimensions, which are external and internal load. In the external, I already mentioned a bit. External is something happening outside the body, something you can observe. Basically is normally are measures of behaviors in terms of training. Internal load are the responses to these behaviors. And so if you want to measure, you operationalize in a way that produce different variables that can be temporal variables or repetition or sets or whatever, workforce. There is a lot of discussion also about the term work, workload, and work is a term that can identify a physical quantity, but is also a term that usually reflect in generic terms. Work is an activity requiring some efforts, mental or physical. And why someone suggested this is confusing, in my opinion, it's not, unless people confuse the different meanings. But when there's a lot of examples in which workload is used to indicate just an activity, not the physical quantity. And it's not confusing, in my opinion. Also from a practical point of view, I don't think when you talk about workload with the coach think about the integral of the area or these kind of things. So and this is another important concept, because definitions should reflect the current understanding. Yeah. So this is a way to generate this definition. But anyway, is by this process of operationalizing that we can obtain the measures. Lesson we can learn from epidemiology. So in epidemiology, you normally, when you read papers, also books of epidemiology, they mainly mention about exposure and response, exposure and outcome. So exposure in epidemiology is a generic term that reflects the amount of a factor to which a group individual was exposed. I think I use this also because this is interesting. You have to think that this definition is the official definition in a dictionary of epidemiology, edited by Porta with a lot of big names. So just to say that is a quite established definition. It's not something that I cherry pick somewhere. Is quite common, this definition. And some people, when I spoke about that, wonder why. Yeah, but the amount of a factor is very generic. No, that's what it is. It's a generic term, and that's the same concern when we talk about training load. It's too generic. No, it should be generic because it's a multidimensional construct. So the definition should be not too specific because it should incorporate the different subdimensions. Of course, we have to be careful in not to conflate the vagueness with generic definition. That's I agree, but generic definition for higher order constants are really normal. In terms of epidemiology, it also reflects the presence of the substance in the environment external to the body. And you will see now that there's a lot of use in epidemiology of external and internal. The dose normally refer to the amount of this factor that enters or interacts with the organism. And this produces a response, which is a quantification of a biologically relevant effect. So these are the definitions. The exposure is the amount of a factor. A factor is also a behavior. exercise, physical activity, eating habits. These are sometimes behaviors that are used as exposure. Just to explain you that also in epidemiology, exposure can refer to an agent like a substance, but also to a behavior. So if you would explore this area, you may find that you can find that in epidemiology there is also this classification of external and internal dose. So while exposure is a generic term to identify the amount of effector, the external dose in, for example, occupational epidemiology, but also in pharmacology, is the amount of individuals are physically exposed and the presence of a substance in the environment external to the body. When you read the exposure in an epidemiological paper or textbooks, they mostly refer to external to the body. So exposure is used in epidemiology as often as a synonym of external dose. But when they talk about dose or internal dose, they always refer to something happening internally to the body. So in this classification, there is the exposure, which is the overarching concept. There are two subdimensions: the external dose, which is the substance in the environment, external to the body, or the amount of effector to whom individuals are physically exposed. And there is a quantity of this amount that is internal, that is absorbed, okay? And this creates a response. So this actually find a good correspondence with the classification of training load, where training load is this overarching construct, in our case, define the amount of a physical training done. The external load is the something that we can observe and is as a behavior that we can observe and we can quantify. And the internal load is the internal to the body response experienced by an athlete, so something happening internally. Why this is conceptually similar? Because you can expose two persons, I start with epidemiology, to the same amount of pollution, but given individual characteristics, the quantity that is absorbed internally may be different between individuals, even with the same external exposure. If you think about training, we can have two athletes training at, let's say, 200 watts, two cyclists training at the same external load, but the internal response, so how they physiologically cope with that amount, may be different because of different characteristics. And these different characteristics, like in epidemiology, can change over time, okay? So that's the reason why these two concepts are associated. And in our case, that there is the response, which is normally performance or health-related outcomes. It's important that we always stay focused on the response that we are interested, which is in sport, is performance or health-related outcome. So in epidemiology, there's as you can imagine, there are a lot of studies trying to associate exposure to a disease or something else. And they have the same problem that we have. How do we measure this exposure? You know, and the idea is to use a measure that quantify a mechanism of action. Okay. Also, the biomarkers are most of the time proxies of the biological mechanisms. So that's how the exposure, how in epidemiology, they try to select a measure of the exposure. This probably you have seen this because this is a DAG. The reason why I'm showing you the DAG is because what I'm talking about now is within a causal framework. Okay, so I need a measure of a mechanism when I'm interested in understanding the causes, because the variables that are supposedly be the cause are the variable that I want to manipulate to change the likelihood of an event. So I'm interested in the cause. I don't touch because I don't have so much time, but of course, if you are, for example, focusing on prediction, that's a bit different, because in prediction, you focus on the prediction. If it works, if you are accurately predict something, I know it's an extreme simplification, but in theory, I can use whatever I want as long as I have a good prediction. So I'm not really interested in understanding if the variables is causally related. And this is something that normally prediction models don't give you this information if it's causally related. And this is also one of the sources, in my opinion, main sources of errors in interpreting prediction models. When I read a paper mentioning prediction, the first thing I look is how is the prediction? Does it work? Is it externally valid? I don't focus on the variables. That's something I can do later as a sort of secondary outcome, but the main outcome is I'm predicting the event I'm interested in. In this context, we are talking about more causal associations. I mentioned at the beginning, I showed you at the beginning this framework, and I just show you a bit, but I'm showing you as an example why we need the framework. So we wrote this paper during the debate about the association or hypothesized causal association between training load and injury. And we said, okay, if you want to interpret those results as causal, you need a framework. Otherwise, I mean, these are just a bunch of associations. We don't know if there are confounders or whatever, effect modification, these kind of things. Most of the studies don't show the performance of the prediction model. I would say, for example, I haven't seen a calibration plot showing the performance of these models. Anyway, we developed this framework because the idea was to start with the framework to understand what measures eventually to use to understand causation between the causal relation between training load and injury. So that paper was the first paper to try to reach to understand what measure to select to run studies in that direction. So we identify several characteristics that can influence injuries. So this just to show all this a bit better, this framework. So I have to be honest, that was also for a PhD student a huge work, because you need to read a lot of literature. So you take 1 year to do something like that, and you need someone that is very engaged, because it's very boring sometimes. Anyway, I just focus on this because this is why you have an injury, and I don't want to say it's unquestionable, but at least it's very logical. So when you break something, any kind of material, can be a tissue, can be a piece of wood or whatever. The reason why you break something is because you apply a force on a structure, and this force is superior to the strength of the structure. That's the ultimate reason why you have a break damage. So in our case, an injury. So the idea was to say, whatever variables you use, at the end of the day, should influence these two components. So the tissue-specific strength or the tissue-specific stress strain. So the load I'm applying on this tissue. So if we want to monitor, or if we want to find to explore the associations with a causal goal, we need to have measures. And the potential measure of exposure are all the measures that reflect the mechanism, as I said. And of course, these are complex multivariable phenomenon. And so I may have potentially a lot of measures, okay, because I have a lot of mechanisms. The problem is that we don't have adequate proxy measures of most of the time of these mechanisms, because you have to think that the measures are almost always surrogates or proxies, because the ultimate biological process is, let's say, at molecular level. But unless, if we could monitor all these pathways, maybe in 100 years, we will have some technology that allow us to measure all these biological aspects. But at the moment we just measure proxies. And we have to be careful that, and we have to always think that we are measuring proxies, surrogates, okay? We are not measuring exactly the mechanism. So, but potentially this is what we need to do. So also when we use proxies, the proxies should in some ways be associated to the mechanisms. I show you another analogy between epidemiology and what we have done. This is the definition of how they measure cumulative exposure. This is something really, this formula, basically, it's easy. That's why I show the graph is the area, the black area, you know. The reason why I'm showing you this is, first, this way to calculate the cumulative exposure as really decades in epidemiology. And we can simplify in cumulative exposure is as intensity per duration. And this is a typical formula that you can read in some old books or even recent books in epidemiology. You can measure the intensity with RPE, and you obtain the session RPE because you multiply by duration. So this is the formula actually for epidemiology, but in sport, we do something similar, because we have a lot of measures that are obtained multiplying the intensity by duration. The same is for the heart rate and the training impulse of Bannister. You quantify the intensity using heart rate and you multiply by the duration. But even the volume, as defined the American College of Sport Medicine, is intensity by duration, because frequency for time is duration. So this just to show you that in sport and in epidemiology, we use similar methods. As in epidemiology, the use of this way to quantify cumulative exposure is considered limited, has a lot of limitations. I don't want to address, because as I said, I don't have a lot of time, but there are papers and authors complaining that multiplying time by intensity by duration to obtain one term is a bit limiting, and it is limiting, and there's no doubts. And sorry, again, this is something that I think is 20 years ago, someone also raised in epidemiology. That's a problem. Nowadays, in the last 10 years, there are a lot of advances in analytics. And so we have more sophisticated ways to model the relations. But basically what these authors have suggested, and this is actually one of the big discussions I normally have when we discuss, for example, about the acute chronic workload ratio and so on, is that the best thing is to use intensity, duration, and their interaction. So instead of just using one term, the intensity by duration, you also should analyze the other two components. So in order to know the role of these two terms for example, if you examine a dose-response relation. And you also look at the interaction between these two terms. So it makes sense to use the intensity by duration. It makes more sense to have also the other two terms. And this is what we said is, you can also use the acute chronic ratio, but you don't know the role of the acute and you don't know the role of the chronic, because you have just a combination. And this one can be obtained with different combination of intensity and duration. So it's a bit difficult to interpret from a practical point of view. Just to mention that we have shown that dividing by the chronic generate a rescaling, so generate statistical artifact, but that's another issue. Now I'm talking about conceptually, and I'm making this parallel with the acute chronic because it's something that you know more, it's more familiar to you. But this just to show you that it's better not to combine everything in one number. If you want to know my personal experience, when I analyze the data of the teams, I often have the first graphs they send me are graphs with the intensity and duration combined. And normally I say, okay, first give me intensity and duration in the same graph or in a dashboard separately, and after you give me the combination, because I want to know how this number has been generated and by these two terms. Okay, so the fact that we validated the session RPE in soccer, it doesn't mean that I'm just focusing on session RPE as a single term. So that's just a personal clarification. Actually, I rarely use, but also at that time use intensity by duration alone. So I finished with the revised framework. So basically, what we have done in this paper written by Annie Jeffries, our PhD students, is that there was something missing. In the 15 years old paper, as I told you, we explained that, for example, heart rate variability is not a measure of internal load, but is more something happening after. So technically, in the way we have presented, it's not a measure of internal load within our framework. But in our framework, actually, there was no place for the heart rate variability. So being heart rate variability is something that you can measure to monitor the process, we start to think, okay, the first framework was from our perspective was okay, but there's something missing. And so we start to re-elaborate and said, okay, let's see if it's adequate or we are missing something, and eventually we can also explain and elaborate better the concept. So we came out with these additional components, which is the training effects, to differentiate what happened during and what happened after the training session. And we wanted also to underline that when you measure a training effects, you always have to consider that there are other two characteristics that sometimes you cannot incorporate, you cannot separate. So you have acute and chronic responses. So if you measure I provide an example of jump height after a training as a measure of neuromuscular fatigue without entering in, let's say, maximal isometric contraction. So also physiologists are happier. If you use that, you have a combination of the acute and acute and chronic effect, because the players or the athlete is training over time. So this is increasing the strength, but is also accumulating fatigue. And when you train and when you measure this after an exercise, this is the result of the accumulated fatigue and the fatigue induced by the exercise after which you measure. So you have this combination, and it's not easy to separate, but this is important to understand that, that there is this interaction. Why? Because if you measure someone after the training and you want to know the acute fatigue, you have to control the chronic fatigue. So what they have done chronically, sometimes you cannot do that. So you don't know how to do that if you have a single measure. I will explain. I will explain how we try to separate the acute and chronic response in a few minutes. But anyway, and you have a negative and positive. So as I said, you're training over time. So your baseline characteristics or baseline, I don't know, aerobic power or strength is increasing, but you have also the acute effect, which is the negative effect induced by the last training session. And this is the concept of the Bannister theorem, for example, the fatigue and fitness components. And in the paper, we explain that we use some reference frameworks already available in the literature, which are the Bannister and also the Perpott the purport model. So there were two models. Those two models actually were more mathematical models, but we extract the concept behind the mathematical concepts. The training effect can be measured in different ways using physiological measures, subjective, functional, and whatever. We also added another component, and we wanted to explain that individual contextual factors has an effect on any of it, in all these components. Where individual factors are genetics and things like that. And contextual factors, I have some example, are environmental, psychological traits, and all these kind of factors that can influence the response. And of course, these individual contextual factors can be influenced by the training itself, or other than the other way around. So there is an interconnection between all these variables. I wanted just to show an example of how we try to separate the acute with the chronic responses using time series analysis. This is a very easy example. We use these two questions that we have validated about fatigue and recovery. So these are the results. These are two players in a pre-season. These are the days of training. As you can see, as soon as we start to increase the training load during the pre-season, there was an increase in fatigue, which is not a problem. Again, people usually are afraid of fatigue. They say, oh, the fatigue is high. I mean, we are training people, so it's normal to have fatigue. If they are not fatigued, I would say that you probably you're not doing your job as a coach properly. So I'm not scared about fatigue. The problem is when the fatigue is not planned. So the fatigue is outside what we have planned. And that's why, again, I'm saying planning is important. If I'm planning 2 weeks of high intensity training, of course, the fatigue will increase. And this is expected, okay? But what is not expected is something like that. After an increase in fatigue, and you see the fatigue start to remain quite high and stable in these two players, and you can introduce a recovery period. If this is acute fatigue, normally what you expect is with recovery that fatigue perception goes down, and this happening in this player, and this player didn't go down. So these are an example of two players with the similar training, but responding in different way to the recovery. And this situation suggested that it was an acute response and fine, and this was instead a chronic response. So something else was happening here, and actually, I mean, there was a medical problem here. Okay, so the way we analyze this is using this time series analysis, and actually, the analysis is very qualitative. Okay, and I don't think is bad. I saw this a lot in clinical setting. Most analyses are qualitative. We don't need to transform this in a number. I mean, you can try to have a number to reflect this, it's okay, but the number should reflect this qualitative analysis. So most of the time, when you validate the measures, you validate the measure with our perception or the coach perspective, so with qualitative evaluations. And that's something I don't have time to discuss here, but it's something that you should think about. So when you monitor, you should measure, or you can measure all these aspects. Of course, if you are just monitoring external and internal load, you know, if you use a framework, that you are missing some pieces of this of the process. And this is not per se a problem. This is just to remind you that you are measuring only few aspects of the training process. The advantage of having measures of external, internal training effects is that you can try to estimate other aspects of training, something that we call training tolerance. So if you see that for example, that the power output is similar, but the RP is increasing, so they are perceiving the same amount of work as a higher in terms of exertion, you may suspect there's something wrong going there. And the same is with your heart rate. You have the same power, and you may see a drop in the heart rate, which is a good normally having a lower heart rate, but a lowering in heart rate may also indicate fatigue. But you can spot this if you compare RPE with heart rate. So you see a drop in heart rate, but an increase in RPE. This usually suggests there's some fatigue there. This is just an example to just not to remain too theoretical, and to explain you that you can, these are frameworks that can be used and are useful in practical setting. The same is, for example, for the muscle pain. You expect some pain after some exercise. For example, after eccentric exercises, you expect muscle pain, but you may have muscle pain after exercise where you didn't expect. So when you plan the training, you didn't, maybe you plan an increase in load because you don't expect a lot of muscle pain, but at what point you have more muscle pain in some athletes. And this is something you know by measuring the effects of training on a routine base. These are really example. The reason why I indicated power is not because power is the best indicator of external load. Power in this example is how the coach designed the training. So the training was designed with trying to suggest the power that the cyclist should reach during the training, and that's why power is my major reference measure. And this is a reference measure because power should reflect the metabolic, let's say the metabolic cost, and this reflect the energy expenditure. The higher the energy expenditure, the higher the involvement of the aerobic system, and so on. So there is a reason why I'm using power, because I associate power to mechanisms that should improve performance. In this case, power is associated in my example to the aerobic involvement, the involvement of the aerobic system. You can use heart rate as indicator of internal load, because you manipulate power to induce cardiovascular responses. So you measure heart rate if you can. So you see how your external load is influencing your heart rate, and heart rate is a surrogate, again, of more complex mechanism, aerobic mechanism. And you can measure the response on a regular basis, for example, heart rate variability or subjective measure. So this is an example. But if you are training in attitude, like I did a lot with the cyclists, you may want to have some measures of this contextual factor. In this case, the contextual factor is the environment. And why? Because this is an effect. So if I use the same program that I use at sea level, I will have different internal responses and different training effects. And that's why I'm manipulating the environment to change the responses of the player. And I may want to measure the variable associated with the contextual factors. These are just examples. So the question is that without the reference framework and a specific hypothesis, you cannot examine the validation. There are a lot of studies and people saying, oh, this variables, this matrix is valid because it's associated to something. Yeah, but I don't know if these associations are evidence of validity or just random association. And the problem is that we tend to give a meaning to these relations, and we create ad hoc hypotheses. So maybe we have just noise, just results that are due to are random, and we try to give a meaning. And the problem we have in sports science is that this speculation is what you find in the last section of practical recommendation. So we recommend to do this, this, and that based on studies that are supposed to be exploratory, associational, descriptive. And this is the problem we had with the training load and injury. There are no studies, maybe now there's something they're trying, but basically we have more than 150 studies not examining causation. And we insist to tell people how to manipulate the training load to decrease the injury risk, which is a causal statement. So it's fine as long as you try to establish causation. even if it's using causal inference has some limitations, because there are some limitations, at least is an attempt to control for factors that can influence this relation. And I tell you, it's plenty of factors that can influence the relation between two variables. And in epidemiology, this is a very common problem. And there are a lot of methods that can try to help you in understanding how to control the variable. Like the DAG is a good way, but the DAG, for example, is difficult, is absolutely difficult. For just two variables with Judd, we are working months because we discuss about this arrow goes not in this direction, in my opinion, in this direction. But this is good because to support my idea, I'm going to provide Judd the literature. I say, look, there is this literature showing this kind of relation. It can counteract, say no, but there's this literature showing the other way around. And this is a way to organize our thoughts. And it's frustrating because sometimes you have 2 or 3 models. You don't have one because there's no strong support for any of these models. But it's good because when I read the paper, I see their causal assumption. I may disagree, but that's not the point. The point is that I know the assumptions of the authors. And this is the only way I can have to interpret properly the results of the studies. And in this paper, we show an example. I don't spend time, but this is an example about performance readiness. So first of all, as you remember, you need the label. Okay, we have called performance readiness. We need a description. We don't have any description in the literature about performance readiness. You have tons of description. You have people measuring performance readiness using the so-called wellness items. But if the wellness items are items to measure the wellness, how can the same items used to measure readiness? So what we are talking about? So what is wellness and what is readiness? And this is important because the correlation between the measures that I want to use to validate the performance readiness need to be coherent with the framework, because people tend to interpret that when there is a relation, this support the validity. But that's not correct, because if in your framework, conceptual framework, 2 variables should not be correlated and you find the correlation, this means that this is not valid. So it doesn't mean that there is an association, so some ways it should be valid. If you are saying I'm measuring 2 different constructs and you see a correlation of 0.9 between these 2 constructs, you are measuring the same constructs. So you are not validating your idea that you are measuring 2 important aspects of training. And try to run a correlation matrix with the measures of training load, if you have the data, and you will see that there are a lot of variables that have correlation higher than 0.9. And the reason is that, I just make very simple because I'm closing. Normally, when you do more, you do a bit more of everything. That's the point. So when you have a high training total distance, you tend to have high acceleration load, high player load, high of everything. But that's the problem, because the label, and this is a study we are trying to do, the label influences the way coach interpret the variables. So if I call 2 variables that are correlated 0.9 each other, which means I'm measuring exactly the same thing, but I give 2 different names, the coach give meaning to the name. So if I call something like metabolic load, or I call acceleration load, the coach interpret in a different way. And maybe they develop a training program in a different way because they see that some exercise increase the acceleration load and some the metabolic load, but in reality are the same exercise that increase both. Okay, so this is very important, and it's important that you have a conceptual framework. So basically, I try to explain a bit the concept of training, of these terms that you have seen here in this framework. I try to explain you the fact that external internal load classification is not something naive, but is something that just reflect other area, like in epidemiology, they use this classification to differentiate the external the external exposure with the internal, what happens internally, what part is absorbed, what is happening. And indeed, the exposure is also physical activity in epidemiology, which is fine because it's okay. It's not the dose. When they talk about dose, normally they talk about energy expenditure because it's something more internal, okay? Even in epidemiology. So they perfectly fit in the two kind of classifications. And these framework are what you need to develop this hypothesis. What you see here, these are hypotheses that you test. And this is what also can tell you what statistical analysis to use and what to expect. And you develop this is the science. You have an hypothesis and you test your hypothesis, but you have to create the hypothesis, and this can be done only if you have a conceptual framework. Thank you very much. I know I was much longer. I apologize. I really apologize. Yeah.
Great, thanks. Thanks very much. I have to say I kind of lost track of time myself. I really enjoyed. I was trying to hang on every word there to make sure I understood everything. So yeah, thanks. Okay, I'm going to open it up for questions. And I think Joel, you got a question in the chat, so I'm going to ask you to ask it first, and then maybe Elijah, I'll go to you next if you have one.
Can you hear me?
And now, yeah.
Hi, Dr. Impellizzeri. Thank you very much for the talk. It was great, fascinating stuff. I just had one question, kind of going back to your time series modeling. I thought that was great. I haven't really seen that concept. I don't know. I think you said it's still under review, so I don't know how much you want to talk about it. But I was just curious what type of model that is. Is that some sort of like a REMA time series model? And if so, how do you tune those the moving average and autoaggressive coefficients?
No, I just show because I actually use that example in more practical seminars where I have coaches and also sports scientists, and I normally try to transform my theoretical explanation in something easy that can be applied by anyone. So in that case, it's just the raw data. I have to tell you that smoothing when you analyze the data is something concerning me a lot, because you smooth noise, and this is not noise. So if I have done the day before 10 repetition more or 1 kilometer more than today, and I have these fluctuations, this is not noise. This is what I have done. And normally when you analyze the data, so if I analyze the data today to understand if I have to modify the training tomorrow, I need to understand what I have done the day before. I don't want to have a smoothed curve. I use smoothing when I want to analyze over long time periods how was, and that's the situation in which I use these cumulative measures. But normally I can tell you in the years I moved from trying to find few numbers to look to find so few numbers combining different things like sessional PE, this kind of, to be to a completely different approach. Instead of trying to combine in a single term, I select the measure. So I just look at the measures that I'm interested. And I give you another very practical example. I was working with a coach and I asked, okay, why are you doing this training tomorrow, or this kind of training overall? And he said, yeah, because I want to train neuromuscular components. So, okay, but why do you think these neuromuscular components are trained in this way? Because I have a lot of accelerations. So I said, okay, let's measure the accelerations. And I focus only on the accelerations because the idea was to obtain a lot of accelerations to improve neuromuscular components. I'm not questioning the coach about whether this is right or wrong. I'm there to help him in doing what he wants or she wants to do. That's my job. If they ask me an opinion about if this is effective or not, I can provide the opinion. But sometimes in the, let's say, analytics or in the analysis or interpretation, we are there to help someone that is paying professional sport a lot to train someone. So it's not my job to tell him or to tell her what to train and how to train, unless they ask me. For example, in this case, I was asked, do you think is a good way? And they said, look, let's have a look to the data. And I showed that with those small sided games, there were a lot of acceleration in the let's say below 2 meters per second square, and said, look, there are not a lot of high accelerations in that kind of training. Because they and this is very deceptive, because normally they say after this training they feel pain on the legs, so they think this is because they are training neuromuscular component, but that's actually was the volume. They're doing a lot of small accelerations of low level accelerations. So I said at the end, look at the distribution. I have to tell you, I work a lot with the distribution, which is a bit of qualitative analysis, but I prefer to have a qualitative interpretation of the distributions, and say, look, there are a lot of low accelerations. There are not at all high acceleration. There are just very few. In my opinion, you are not training the neuromuscular component that way, and actually changed. Yeah, I hope I answered to your question.
Yeah, no, absolutely. Thank you very much. Yeah, that makes a lot of sense. Yeah, because obviously, kind of the similar thought process of how the smoothing, and if you're just filtering the noise, and kind of missing some of the actual physiology in the training process. Yeah, thank you very much.
Thank you.
Thanks, Joel. Elijah, did you want to ask a question?
Yeah, I was just wondering, like when you're discussing your framework, I wasn't really sure if do you specifically target injuries, or can your framework, discuss natural responses like working out or gaining muscle, that kind of thing? And maybe does your framework do a better job, one or the other? And just by the way, it was a great talk.
I show you two frameworks. One is about injuries, and one is about the training process. One is specific to injuries, and the other is just the training process. How the two may be associated, because if with the framework on injuries can tell you what I want to train to decrease the injury risk. For example, as I said, the injury occurs because you have a load that is superior to the strength of the tissue. So I may want to train to do a training that improves the strength of the tissue. There are studies showing that eccentric training can increase the number of sarcomeres in series. So I say, okay, I use the eccentric training because my idea is to have a stronger tissue, and I develop my plan. And how do I develop my plan? I develop the plan deciding what kind of external load. For example, in eccentric training, I don't know, it depends what kind of exercise I can use, machines, and they say, okay, I set this kind of value to induce this eccentric load. In that case, normally you don't have the internal load, but you have in your mind the internal load, because the idea is the neuromuscular system. That's, you would need a measure of neuromuscular involvement that we don't have. It's okay. That's why we use a lot the external load. This induces the training effect. So my idea is to not to generate too much fatigue, for example, because I want to normally when you train more neuromuscular component, you don't want to accumulate too much fatigue. So you measure the training effects. You are doing this maybe during summer, so you have contextual factors, and you want to measure humidity and temperature. So the two are correlated because one tells you what to train and the other how.
Yeah, amazing. You gave some good advice. Thank you.
Thank you.
Okay, is there other questions from the audience? Maybe while we're waiting. So yeah, this is very, very thought-provoking, and I appreciate the rigor with which you've delineated these concepts and then drawn out the framework. So one of the things, so I study some of this, these things from sort of top down and bottom up. So what the cell is seeing. So what I think about with training is, what are the cells, in this case, let's say skeletal muscle, what is that seeing, right? And what they're seeing is, you can distill the external load of exercise and presumably some of its internal load responses into these distinct biophysical and biochemical stimuli that the cells are able to sense, and then signals are generated within the cells that have a dynamic. And so in your framework, you've delineated things that happen during exercise and things that happen after. But in my world, things that happen during exercise continue after. And a lot of what's, the acute response to sustained homeostasis, for example, isn't causing the adaptation. There are other processes that they may or may not cause the adaptations. So is that a problem, or is this something that you can easily reconcile within your framework?
I think they are quite coherent. What you said is coherent with the framework, because you have a response during the exercise. You said, okay, there's something that go on after, and these are the effects. I mean, if you imagine if you're doing something 10 minutes and you do 5 minutes, what is going on after change. So it's an effect of the duration of how much you are stimulating during the exercise. So that's why we have the training effect. So we have to differentiate what happens also after. I mentioned the heart rate variability because that's something, this is an example. You have some changes of heart rate variability also during the exercise, not only after, but normally you measure after. So you are measuring the effects of what you have done on the response after. The fact that there is a continuum, there may be a continuum, it's okay, it's not a problem, but the effects are always influenced by what you have done. So the stimulus triggering all these responses is the exercise. Right. I think I don't see, honestly, this a theoretical problem. It seems, of course, differentiating, there's something different, but it's just a temporary differentiation. So you stop the exercise and we said, okay, there, we separate what happened until there, and this is the internal load, what happened after, and this is the training effect. That's why we added this component.
Okay. Yeah, so I think that makes sense. I mean, I guess the issue is, does it matter that a variable could be both an internal load and a training effect?
No, absolutely, and that's why you need a framework. Right. Because I give you another example. There are teams using jumps to measure neuromuscular fatigue. You can measure neuromuscular fatigue. You can use jumps to measure neuromuscular fatigue, but you can also use jumps to measure the training effect. So how much are improving their jump height. So the same measure can be used as a measure of fatigue or as an outcome. So you can, I mean, at the end, this is the problem of not having a framework, that you have a variable that you can interpret in different ways. So you have to understand when you interpret what's the meaning in the process of that variable in that moment and the way you are interpreting that moment. So I think it's not a problem if you have a framework. There's no variable or constant that incorporated the framework. It's like validity. Validity is a contextual concept. People say, oh, but I'm using something valid. Yes, but it's valid to measure heart rate, but heart rate is not a mechanism of resistance training. So I cannot use heart rate for resistance training. I mean, the typical heart rate in percentage of maximum heart rate, because it's not reflecting a mechanism that is causally related to the outcome. Mm. And that's why I like the way in epidemiology they select the measures, because they should reflect a mechanism. So if you tell me, what do you think about the player load? A lot of people ask me that. I say, I don't know, I have no idea, because I don't know what mechanism is measuring training load. If you tell me training load is measuring neuromuscular component, that's the way I can to validate eventually. I run a study, I see if it actually measures the neuromuscular components and if it's better than other measures, other maybe old measure. We don't need to invent every time a new measure. At the end, we analyzed with Andrew Novak, in a database, there were something like 200 variables, also considering the different levels of the same variable, but there were 200, at least the 200 variables. I mean, it's impossible that we have 200 variables measuring 200 different things, because you get in reality, there is a huger problem there, because we have multicollinearity, but our multicollinearity is because we calculate all the variables from the same two variables, which is time and coordinates. So whatever we have in that list is generated by these two variables. So we are creating on purpose sometimes this collinearity, because we calculate is mathematical.
Yes.
Which is also a problem with the PCA, because the principal component analysis. The problem, the main concern I have is that we don't have to solve the problem of multicollinearity with the PCA, in my opinion. We have to avoid to create the collinearity. So it's an easier solution.
Okay, that's great. So maybe I'll just end the recording now, unless there's any other pressing questions from the audience. It looks like there's not. So I'm just before I shut the recording, I'm just going to thank you very much again for a really engaging talk and answering all the questions. So thanks again.